Hello, my name is Tyler Good, and this is my presentation on hospital accreditation and conditions of participation. So hospital accreditation is in place purely to improve the quality of healthcare given to the patient. It also ensures that the hospital is taking the proper steps to maintain their facilities and to stay up to date with modern practices. There are 6 different types of hospital accreditation. There's preliminary accreditation, accredited accreditation with follow-up survey, contingent accreditation, preliminary denial of accreditation, and denial of accreditation. Let's go a little bit more into depth about those. So, preliminary accreditation meets the standards set on the first 2 surveys as required on the early survey, which is given to them by the Joint Commission. And then it pretty much acts as like as a pretest, and then their post-test is what gets them accredited. It's also known as limited accreditation, and this does not act as their accreditation. This acts as the initial thing saying, hey, you're going in the right direction. Next is accredited. That just simply means that they have met all the standards, or they've complied with all the standards when the on-site survey was conducted, or they have addressed all the requirements for improvement, which are known as the RFIs, in an evidence standards compliance within 45 to 60 days following posting of the accreditation survey findings report, and it does not meet any other rules for accreditation decisions, meaning that they have everything together. The accreditation committee has decided that they are good to go. Next is accreditation with follow-up survey. This just really means that they have 1 or 2 things that they need to tweak. They're not in compliance with a couple standards here or there that are set. It really just says, hey, you're accredited, but we're going to come back and we're going to see all these things that you need to fix, and we want them to be fixed within the next 6 months. Next is contingent accreditation. This means that the follow-up survey shows no changes made to comply with the standards. So this is the follow-up survey that was done from the last slide talking about the accreditation with follow-up survey. This is pretty much just saying that we told you, you haven't actually done anything about it to fix it. So this also means that while they're still accredited and able to practice, they only have 1 more chance before they are denied accreditation. Another way that they can get this is not having possession of the required licensure or some kind of similar issue at the time of their inspection or their survey by the accreditation people. Next is preliminary denial of accreditation. So this means there has been a clear justification for accreditation denial due to several different factors. This means that there is one of these 4 things. So there's an immediate threat to the health or safety for patients or the public, failure to resolve requirements of accreditation with the follow-up survey after 2 opportunities, failure to resolve contingent requirements of accreditation, and lastly, there is a significant number of non-compliances with the Joint Commission standards. This means that this is the last straw before you are denied all accreditation. And this is where things can get a little hairy for the organization. And then finally, last but not least, once they have gone through all of this and they have found that you just don't care about their standards, they will deny you accreditation, which means that you can no longer practice or provide any kind of care to any patients or even admit anyone. So next is the conditions of participation. These are used by the Center of Medicare and Medicaid Studies, and they're typically They go hand in hand with conditions for coverage. While they are different, they are typically put together in the same category of standards. These are standards which an organization of healthcare practice must meet in order to participate in the Medicare or Medicaid programs. They promote quality improvement and protection of health and safety beneficiaries, and it actually applies to several different healthcare organizations. These organizations include things like the mental health organization, and just a lot of different places that have to abide by these in order to serve anyone that has any kind of Medicare or Medicaid. It also requires these different organizations to provide information to their patients about their rights and care that they deserve. So, that is it for my presentation on hospital accreditation and conditions of participation, or CoPs. This is my wonderful reference page. Thank you so much for watching, and have a wonderful day.